Helping to bring new life into the world is a special part of how Bloomington Hospital serves the community. For Stacey and James Mitchell, the birth of their twins, Gabe and Ava, was an early, special delivery.
That Monday morning I woke up and I was still having cramps, and I went to my doctor, and he determined that I was in labor, so I definitely felt scared and apprehensive, and it was, 4.5 weeks early, so I wasn't expecting it. Things weren't taken care of. I did go over to the hospital immediately following my doctor appointment. I was over there at 10:30, and by 12:30 I was in the operating room.
A very surprised dad, James, rushed from work to be with his wife.
She was already in the surgery suite, and I showed up, and they were already waiting for me, so I had to scrub real fast and get ready to go in.
At Bloomington Hospital's Regional Center for Women and Children, a team is on hand 24 hours a day to provide the care mother and baby need, especially when there are complications or things don't go as planned.
Right after they were born, it seemed like there was a whole team of people in the room, and they took both babies and started, cleaning them up and got them under heat lamps and taking all the vital signs. And then, they started taking care of Stacey, getting her ready to be all sutured up. And then when they got done with her, it was like, wow, that was amazingly fast.
I first got the news that Gabe might need extra help, I think, soon after I got into my room. Not in recovery, but when I got back to the postpartum room, they told me that Gabe was having trouble breathing and he had to be on a ventilator.
Gabe and Ava's team extended to the special care nursery, where they got the extra attention they needed.
When I went down to visit them in the special care nursery, I went down that night, and that was really hard. I'm going to cry now. Seeing him on the ventilator was really hard because you just want to hold him and nurture them, and I couldn't, because your first instinct is you want to hold your babies, and I couldn't.
Initially I was pretty scared about, the babies having to need special care. And just after meeting all the nursing staff that worked in there and the ability to come and go as we needed, that really helped out. It was really reassuring. And if I had any questions, because I'm very inquisitive about like the technical stuff, how many beats per minute is normal and things like that. They were very receptive to that and very accommodating. And so they, through their technical expertise, they really put me at ease.
Patient-centered care at Bloomington Hospital not only provided the necessary attention for the twins and Stacey, but also helped the Mitchells develop trust in the staff who served them.
I felt like I was taken great care of. I felt like a guest also, in that the nurses, would talk to you and share experiences that they had had personally. So you didn't feel so far away from, the people who were taking care of you. You felt more like you had a personal relationship with them.
I think Bloomington Hospital is a place where you can go and receive great technical and care for your children without losing the personable touch.
Today, James and Stacey Mitchell are home with Gabe and Ava and eldest son, James. Care they received at Bloomington Hospital's Regional Center for Women and Children helped this family get back to their lives with a couple of very small, very special additions.
Now that they're here, it feels great to be the mom of twins. A little overwhelming, but it feels really good. It feels nice having a big family.
Bloomington Hospital. Advancing medicine. Enhancing health.